Facing a crisis in your life or business? Take the helm and steer yourself in the right direction. It's time to take charge and make things happen with your host, Lynn McLaughlin.
Hello, everyone. Today's guest is Sonya Boersma. She is a master's educated registered nurse and an international board certified lactation consultant. Sonya's goal is for families to receive evidence-based care and support. She's also coached healthcare organizations and so much more that we're going to hear about today. Hello, Sonya.
Good morning.
Let's start with the importance of breastfeeding. It's been a long time for me, but I think back to my circle of friends back in the 90s, and it was never a question for us. Why is it so important for us to be doing this?
You know, a lot of people understand that it's better to breastfeed, but I don't think they really get how much difference it is. And we're still coming out of being a bottle feeding culture. So when we consider that breastfeeding is the biological norm, then we can see that there's risks to not breastfeed. So for example, for an infant, there's a higher risk of ear infections, lung and breathing issues, hospitalizations, diarrhea, sudden infant death syndrome or crib death, and then longer term things like obesity and being overweight, chronic illnesses like diabetes, and even some childhood cancers are more frequent in infants who aren't breastfeeding. And that's not to say that this is going to happen, but it's like any other statistic. If you smoke, you're more likely to get lung cancer. And we have very clear evidence that babies who aren't breastfed are more likely to have some of these health issues. And then what's really interesting is that for mothers, there's implications as well. So for example, mothers who do not breastfeed have a higher incidence of breast and ovarian cancer, as well as postpartum bleeding and type 2 diabetes. And there might even be a link with heart disease there, which is new emerging evidence. So that's not a comprehensive list, but you can see that it makes a big difference to health outcomes.
So what is the biological, the physical reason that makes these risks higher if we're not breastfeeding for both the child and the mother?
Sometimes formula or infant formula is called artificial baby milk. And I don't mean, this is not a judgment for anyone who makes an informed decision to use formula or who even needs it for medical reasons. And I sometimes will recommend it too. But it is hugely different than breast milk. It comes by and large from cow's milk. And when we do recommend formula, it's cow milk based formula that we're recommending. And the substances in that are augmented to get a little closer to breast milk. But there's in fact thousands of components to breast milk that a lot of them might not even be known yet, but more and more is getting discovered. It's just a completely different substance. And then how a baby feeds makes a difference too. There's a bit of a cultural thing that some people are giving exclusive breast milk by another method. So say breast milk feeding by bottle. And while that's a great second choice, it's not as good as breastfeeding because that skin to skin makes a difference. Babies are also getting health benefits just by being skin to skin with mom, sharing their microbiome. There's a reciprocal relationship. If mom's exposed to something, she'll develop antibodies that go in the breast milk that baby will get. But if baby's directly on the breast and has been exposed to something, that'll go into the breast, and from that antibodies will get produced and go out to the baby again. So it's a fascinating relationship. So asthma rates, for example, are higher in babies who are breast milk fed compared to breastfed at the breast directly.
My goodness. Well,
so
this leads me to a question in the midst of this pandemic. And I have a family member who is breastfeeding right now, beautiful little baby, and is hesitant to have the COVID vaccine. And there's a great deal of information on lactation care about that. So what are some guiding principles around making a decision to breastfeed when you're afraid of a virus and or the vaccine?
That's been quite interesting since this pandemic started. First of all, I was kind of between and betwixt, and it was a pivot point for me. I was hearing some myths around COVID, and I was hearing about separation of moms and babies, and it was breaking my heart. And I thought, oh, I have done private practice for a long time, and I've also been in the public system. And I was at a crossroads myself. And when I was hearing these things, I thought, I have to jump in. I just have to help out with these moms. And a lot of the resources that were available were gone for breastfeeding moms. So when I heard, when I've been hearing things like, what are the effects, should a mom breastfeed during this pandemic? It's like, yes, we knew already at the beginning that other coronaviruses were, babies were getting support through breastfeeding. When there were other coronaviruses, we now have that evidence for this virus. And it's just so important for parents to continue to breastfeed. So some people are working harder at breastfeeding now, which is really interesting compared to before, because they want that protection for their babies. And I just recently been meeting some moms who said, I'm going to keep breastfeeding longer because I got vaccinated and I want my baby to get these antibodies. So that's really fascinating. And I'm very happy that that's evidence is strong enough out there and known enough out there that parents are getting motivated by it to support the health of their infants.
Awesome. Thank you very much for that. And there's more information on lactation care. Let's talk about the prenatal path, because you're supportive for families in that prenatal stage. And I go back and I think about, we used to go to coaching classes, for giving birth. Are there coaching classes to help people understand lactation and breastfeeding and what they can do to prepare and what that initial contact might look like? What happens today?
There are definitely various organizations that provide some prenatal breastfeeding support, and I do that as well. Right now I'm doing that one-on-one, as well as through conferences. I'm speaking at different prenatal classes and whatnot, but I do provide that service one-on-one with parents to try to set themselves up to be successful and prevent issues after.
Mm-hmm. And you do that virtually now too as well.
Absolutely, which is also a great outcome of the pandemic. There are some good things, right? So now I can reach people far beyond my location. I'm based in Ottawa, but can reach people anywhere in Ontario or Canada. It's fascinating now that I can do this and help parents get set up well for their early days and weeks.
So Sonya, with the people that you've worked with over all of these years, what would you say are some of the most prevalent barriers that make people choose or are reasons for people to choose not to breastfeed?
I think there's many. That's a tricky question in a sense, because they're so individualized. I think there's a lot of myths out there. I don't think people really understand how radically different, like breast is best sort of concept's been out for a long time, and then there's formula, but it's really like the World Health Organization recommends breastfeeding first, breastfeeding mom's own milk a different way second, breastfeeding another mom's milk third, although through a donor, human milk donor bank, and then fourth, formula. So it makes a huge difference. Some of the other barriers are sometimes related to practices that are in our system, and that's where some of my work can come in too, because I love to be working in education around with healthcare professionals, providing workshops or teaching sessions with healthcare professionals to help them implement best practice around infant feeding.
And you have been coaching professionals for quite some time, have you not?
I have, yes. Yeah, I have done work provincially, working with hospitals and community health services. So anything related to moms and babies, I have been involved with. And it's a great pleasure, because I know that those professionals or workers who are working with new moms and new parents have an impact then to many parents, right? If I work with one that's a provider, then many parents are are assisted.
Okay, excellent. Word of mouth. I just want to go back to a question of a little, it just came to my mind, the competing information out there, and we think about media, right? And how much misinformation or misguided information comes to us because of those manufacturers, right? The people that want to sell the formula. So you see that and you think that's the end all be all without having the full picture. Is that part of the reason maybe people choose to go a different way?
I think that's a good point. We are ideally in Canada implementing World Health Organization policy on distribution of breast milk substitutes, and we haven't fully implemented that in Canada. So there's a lot of marketing directly to parents, and it comes in subtle ways, like parents sign up for a baby kit, through their local store that sells, say, prenatal clothing, for pregnant moms. And then all of a sudden they're getting a lovely diaper bag and formula in the mail, and now that's in their cupboard. Now, night 2, it's a sleepless night, baby's up a lot, it's common. But it's so much easier to just reach for that formula. Mm-hmm. Or the hospitals, if they need to provide formula to their infants, if they're bringing a can or something that's branded, a little bottle of 60 mils of formula, and it's branded with a certain company name, then the parents would think, oh, this is the best one. So they've now branded it, and a lot of formula is not necessarily going to hospitals. There's a contract that's involved that doesn't necessarily have full market price attached to it. Mm. And that's because it's really good marketing for the formula companies. So there is a lot of marketing that's happening directly to parents and less directly. That makes a big difference.
Well, I'm shopping. You walk down through the baby aisle in the grocery store, and you're seeing the formula and you're seeing those other products. You're not seeing advertisements saying, "Are you breastfeeding?"
Well, this is it. Formula companies have huge marketing dollars, and the healthcare system doesn't have the same power in the sense of saying, you know what, like use it under these circumstances only. I mean, that is part of the job of a healthcare professional to say, if you choose, you can choose whatever you want. You just have to understand what the differences are so you make an informed decision.
That's right.
They don't have the same dollars to provide that.
Now, Sonya, you find parents to be in different states. Could you explain to us what those are?
Yeah, when with my clients, I find that they're often in one of 4 states. So one is disheartened. I define this as a situation where they're having a ton of challenges. They're maybe at the point where they're thinking about giving up. They might be bottling and starting to find benefits to that, or that it's just been so painful to breastfeed that they don't want to go back. Another state that I find people in is a state I call strained. So this is a state where, despite trying many things just aren't going smoothly yet. They're not sure if the baby's okay. The baby might be crying a lot, way more than expected, or alternatively is just sleeping too much and not feeding enough. Breastfeeding is very challenging, and they're getting mixed messages from all kinds of people, their healthcare providers, friends, Google, and they're not really sure what to do. The third state I call coping. In this state, despite trying a whole bunch of things, they're getting positive results. At least 60% of the time, breastfeeding is going well. If they were to do things differently, they would definitely change things next time, but they're settling for how things are going. Mm. And then the fourth state, I call this thriving. In this state, things are really going well with the mother and the baby. Parents are confident in their ability to feed and take care of the baby. The odd thing might happen, but then they know to reach out for help. They get the help and they settle back into their life with their new baby. Most of my clients come in one of these states, and one of the either disheartened, strained, or coping states, and want to be in that thriving state. And this is why I love it when parents come in pregnant, because we can just help prevent a lot of that or get them to that state of thriving so much quicker.
Well, the prenatal piece, like you said earlier, it's about educating yourselves, learning. You offer a kit. When we talk about, what's all in our faces in terms of the formulas and things like this, lactation care, you also offer, what's the name of the kit, Sonya? I'm blanking out
here. The Golden Moms package.
Golden Moms package. Tell us about that.
It's 3 visits, either by Zoom or in person if they're local. And they would get 3 visits plus 3 follow-up phone calls and then a shorter visit just to wrap things up. I find then parents are in a really good flow. Usually things are going well. Part of that actually is a course that I offer. Parents, it's included in the Golden Mom package, although parents can take it separately. And again, parents from all over Ontario or Canada are welcome to take this. And it's meant to empower early parenting. It's a group, it's a virtual course. Right now it's 4 weeks. I call it Ask the LC, but I could call it Propel Your Parenting. It's about breastfeeding, and it's also about baby care. I've been working with babies so long that there's a real depth of knowledge there. And I know what parents need to know, and we talk about this. We'll talk about holds and positions and infant feeding in public or returning to work or mother and infant mental health, all really burning issues for moms. And the real great thing about that, and the reason it's part of the package, is because it makes such a difference in terms of connecting moms to other moms, because I'm all about building community. And in that regard, I have a Facebook group too that's free. So I'm on Facebook and Instagram with Lactation Care, but I have Lactation Care Parent Connections as part of that sort of focus that is so important to build community. It's so important that parents meet other parents and connect and can compare notes. So the group helps with that. And sometimes the ideal and what I work towards is that the connections last well beyond the course. And then the Facebook page is another option. But it's all included, the course, the multiple visits, and the follow-up phone calls is a really nice package for new moms to come in either late in pregnancy or very early after delivery.
Well, my apologies for referring to that as a kit, because it's much more than that. It's not a kit at all. And, a little personal experience, although my kids are all in their 20s, my oldest one, I was in between those 2 first dates. And I did reach out to a lactation consultant back then, which got us through those first 6 months and a little bit longer with my first child. So I guess the main message is here: when you put yourself in a position, like you say, when you are expecting, to be informed, to make your decisions, to know what the challenges might be, and who to reach out to when you're stuck, when you're in one of those, not the 4th stage when you're thriving, but then you might be helping other people who are trying to get there, right? That community network.
Yes. Yeah. Having the support lined up while pregnant is so valuable. And I admire those women who even think to do that. But, it's a kind of weird system, because I want to say to women, you can do this. Like, I want to fully empower them pregnant and say, you can do this. And it can be challenging, and you might need support. So, and that's the reality. Sometimes parents say, why didn't I know about you before? Why didn't I get you? I wish I got you in before, or I wish I knew it was going to be challenging. And it's all a big learning curve. And it's not just breastfeeding that's challenging, right? Trying to figure out your baby's cues and how to burp and how to do this and how to do that, how to get them to sleep. It's a huge learning curve. So I like parents to give themselves credit and grace for that as well.
Yeah, there are manuals, but it doesn't matter, because each one of our children is different and unique, and we do have to figure them out.
Absolutely. And so it might be your 3rd baby that challenges you.
Mm-hmm. Yeah, they are very different, aren't they?
Yeah, they are very different. I think you speak that point very well.
Sonya, you mentioned your Facebook group. What is that called if people are doing a search for you?
If they want to join the group and their parents or even grandparents, they could join the Facebook group for free. It's Lactation Care Parent Connections.
Okay, excellent. And for people to find you in case they have questions or they're interested in your resources in your course, where are they going?
My website is probably the best go-to place, lactationcare.ca. And people can also follow me on Instagram and Facebook at lactationcare.ca.
Fantastic. Okay. Now let's move over to professional organizations. You also offer customized training and coaching for nurses, doctors, midwives, and health care organizations.
Yeah, so sometimes I'll go into healthcare organizations, and because their staff want to know a certain something. And my goal is always to make it very practical and very fun, and obviously understand what their goals are. There's usually an activity component because as adult learners, we learn better that way. So for example, if it comes down to healthcare organizations wanting to implement something called the Baby Friendly Initiative, and they need to know how to teach mothers how to prepare formula, I'll actually bring in tools. They're not an actual can of formula, but we'll go through all the motions to properly prepare infant formula. So they in turn can teach how to prepare infant formula for their staff, or to the parents that they work with, or even to their new staff that comes in, so that everyone can be up to scratch. There's so much that parents, that healthcare providers need to know about or could benefit from knowing about. So perhaps it's something like how to increase milk supply, which is the world's #1 reason that parents give for not continuing to breastfeed, is they don't feel they have enough milk. So it's good for healthcare providers to know, okay, what are the options? How can milk supply be built? Or what questions do you even need to ask to determine about low supply? Or what might be going on in their life that might be causing it, if there is in fact a low supply. A lot of the times there's actually not a low supply, there's a perceived lack of supply. So then it's what's the assessment that's involved? So this is all very good for healthcare professionals to know about, and some of the things that I might teach them.
Are there still, when people are giving birth in the hospital, there used to be some type of a resource kit that they were given. Does that still happen?
It really varies.
Okay.
Health units used to have a very comprehensive kit, and it's gotten pared down a lot because parents today are mostly using things that are online. So I just happen to have a crib card here. What it is a fold out little tiny thing that's maybe 3 by 4 inches. If you can see the picture, you can see it. It starts off with the basic information that crib cards would have, which is always a keepsake for parents. So baby's name, parent's name, birth weight, birth link. And then it has, it's this great teaching tool, and it's good for parents to know about, and it's even better for healthcare professionals to know about it from the hospitals, because it has what you were talking about, some of that package, some of those teaching tools. So it's got services that are available, how to safely position your baby skin to skin, which is so important for all newborns, no matter how they're fed, to spend time skin to skin with their new one. And I have to say, having been a birth doula, I loved it when I saw the dads doing skin to skin. At that moment, they were smitten, if not before.
Oh, yeah.
Just head over heels in love. So how to do it?
What a brilliant strategy with the crib cards. You're right. We all take them home. They're in our children's babies books forever. It gets passed on to them when they're adults, and there's all the information right there all in one place.
Well, that's it. The 6-page fold out has a little section on how to know things are going well. It's got a pee and poop chart that, you need this many pees in this many days and this many poops when the baby, in these days. And this is put out by the Best Start by Health Nexus. And how to hand express your milk and how to take care of yourself. So it's like this tiny little tool that is such a great resource for parents. Some hospitals are using this. It'd be great if more did. It's available online.
Maybe we have some hospital reps listening to this podcast that will take that idea and run with it.
Yeah, if they're looking for it, it's on a great website called Breastfeeding Resources Ontario. It's a great source for parents and professionals for evidence-based information.
Excellent. All right. Sonya, you shared so much with us today. Do you have any closing words that you'd like to add?
I just really want to encourage moms. They can do this. They often need support. It can take a while to get, and those that persevere do usually reach their goals. And for healthcare professionals, also reach out. There's support. There's people there. I'm happy to come in and support you, be it coaching one-on-one or providing workshops. There's help, and we can help you to help mothers.
And it's all about understanding. And as I say very often in my mission statement, making conscious and positive choices, because we've gathered the information, much of what you shared with us. And we will include all those resource links in the show notes so people can go and make decisions for themselves. Thank you so much again, Sonya.
My pleasure. Thank you, Lynn.
All right. Have a healthy and safe day, everyone.
Thanks for listening. To learn more from people who are steering in the right direction, go to lynnmclaughlin.com and search the archives of every interview or subscribe to this podcast feed. A new episode is published every Wednesday.